If you were to talk to our providers, HEDIS is no longer one of the biggest probably barriers or intimidating things they need to do. One of my big things is having the right information at the point of care. Using the HEDIS dashboard, we were able to populate what the provider needed to know at the point of care very seamlessly. At the very beginning, we were very retroactive. We waited for the gap reports to come from the payers, which were typically anywhere from 30 to 60, 90 days old, and we would react to them. We'd realize that 90 days ago on that patient encounter, we didn't document something properly, and then we'd have to wait for the patient to come back in to capture it. Using the HEDIS dashboard, we're actually able to track it in almost real time. With the weekly refresh, we're able to see our efforts this week and the impact they make by next week to realize and assess them, is our training effective and are we really documenting properly? We're no longer as focused on administrative duties. We're much more focused on providing care at the right time in the right place now. When we had the spreadsheets, we had to dedicate usually a whole Friday afternoon with our front desk staff to do reminder calls. We'd call their home. They're back up in New England. We'd call their cell phone. And now using eClinical, it's in essence automatic now. We can look at the non-compliant list, we can populate a messenger campaign, and it's off to the races. Going into the future, I do think a lot of payers will judge who gets contracts and who doesn't get contracts based on their HEDIS outcome. I would say you could see it as soon as 2021, and I can tell you one of the biggest leverages we had in negotiating those was our prior success with our HEDIS scores. As far as an impact, across the board with all of our payers, we were at least a 4.5, if not higher. Having a strong HEDIS team and a strong reporting gets you the recognition you need from the payers to allow you to remain independent and do what you need.